if a patient falls, what is your first action when you find him on the floor? Assess. You always assess, right? Vitals, and then you assess injury. Okay, good. All right, informed consent, page 24. Okay, so it goes over informed consent, and if you read through it, okay, it says informed consent responsibilities on page 25. This is what I usually understand. Now, I usually do this whole thing, but we're really short on time. I usually ask you guys, when will we require informed consent?
Prior.
People say invasive. So I say, what about a stress test? You guys know what a stress test is?
Yeah.
You need informed consent for it, but we're not,
Because they can have a heart attack.
It's dangerous, it can cause a heart attack, but it's not invasive.
So anything dangerous that can cause harm?
Patients at risk.
Anything that's dangerous that can.
Taking time was dangerous, bro.
That's true.
Anything that can be.
You can have an anaphylactic reaction. Oh, dead.
What's the answer? Addition.
Can you explain the voluntary consent? Like, I guess when
Implied.
Implied.
Called implied. So in short, I tell people, how do you know about informed consent is when there's a reasonable risk, right, to the patient. Like a reasonable and arguable amount of risk to the patient. Diagnostic procedures, invasive procedures, and I tell you, what about IVs? What about catheters? We don't need consent for that. But we do need one for PICC lines, peripheral inserted central catheters, right? So it's more so when there is a reasonable amount of risk and danger, right, of like severe bodily harm or death. So in that case, there's two types. And I don't think it's talking about it here, so feel free to read through this individually, but I'll give you the key points that you should know. You do have implied consent, or assumed. They'll call it like this. Usually it's implied. It might sound like assumed. But it's more so implied is a better word because of their actions. This is what we're talking about. I'm gonna draw your blood so that we can have morning labs. You give your arm, this is implied consent. Yes? We're talking about competent people. We're not talking about delirious, demented patients. We're talking about competent individuals. They can give implied consent. Okay? Gave out their arm. Yes, you can do this, right? You can take your blood pressure, give out their arm. Implied consent. Now, informed consent is written, right? And there's a few key things to know. It needs to be witnessed. And for all intents and purposes, this is the only nurse's job. To witness the informed consent. And it goes over a few things right here. If you look at where it says nurse. Ensuring that the provider has provided, you can like highlight what the responsibility is, especially of the provider and the nurse. Okay? So the provider has to explain risks, benefits, alternatives, refusal, acceptance, like what is the risk of doing this, of not doing this, and what else can be offered. You have to go over the options with the client. The client has to give voluntary consent, not coerced. And the nurse's job is that we witness it, that it was voluntarily, not by coercion, meaning by force, right? Not mom being like, if you don't go through with this, I'm gonna disown you, right? Or like, I'm gonna like take you out of the will, la herencia, right? Like, you're out, right? You're not getting any of the demos, right? And boom, right? She's the one to have, now suddenly she wants to have an abortion, right? Because sometimes parents or family can influence their decisions. So it has to be without coercion, okay? From family or a doctor. Make sure that all the questions have been answered. If they sign the informed consent or they're about to and then they're like, I have more questions, what do? You get the provider. But you can reinforce what the provider has already said. Understood? Okay. Everybody clear? Now, informed consent, I always tell people, make your little list, and every time we go over a chapter or you have, you should go back, and whenever it says informed consent is required, you get a little flashcard of all the procedures that are required. Because those are freebies, man. If they're like, the client's gonna receive cardiac catheterization, what's the first thing you do?
Informed consent.
So if you know that it requires one, that's the first thing you do. You should have a little list, stress test, right? Contraction stress test for pregnant women, cardiac caths, not echocardiograms, but transesophageal echocardiograms, things like that. So you should have your little list.
With the pick, yes.
Everybody good on informed consent? What's your role, the doctor's role, client's role? What if they signed informed consent and they're going to surgery and right before, they're like, I don't wanna do this no more, I changed my mind.
Yeah, they can do that.
Stop it, you have the right to refuse, right? You can stop it even if they're all set up. I had a student tell me that, set up on the table, about to go under, said no. Stop it. She got too nervous, she got too scared. Should be no. Right? I'm like, I didn't hear that. I just like.
Show me afterwards.
Did you hear that? And they just put the sedative. I didn't hear that. So, yeah. A lot of people say that they remember or can hear what was going on. Alright, so we're good on informed consent, right? Alright, we're good on incapacitated workers under the influence. They have the right to refuse, everything else. Okay, let's talk about, we talked about what the APs can do, right? The one that's not listed on there, by the way, what can APs also do? They can do postmortem care, they can say it on there. They can,
What
clean the
is it?
body, right?
Postmortem care.
We talked about incident reports,
Postmortem.
who they can take care of, the APs. Incident reports, once you do them, okay. There's two more things to go over that are kind of important. One of them is, advanced directives, the durable power of attorney and whatnot.
29.
Page 29. Yes. All right. So, the way that best describes it is you have advanced directives, and advanced directives are divided into two separate categories, which could be a living will and a durable power of attorney. Okay? And usually they can have both. Okay, both the living will and a durable power of attorney, because this gives general guidelines as to what should be done. Artificial feeding, artificial ventilation, right, like being intubated. It gives general guidelines of what should happen, but it's not specific, at least not as it could be. So then that's where a durable power of attorney is good. I do wish to receive enteral feeding, but not more than 3 months. Okay, if after 3 months I'm brain dead, let me go. Right? So this mixture is good. Advanced directives is, what do we do in the event that you cannot make decisions? Living will sets guidelines. Durable power of attorney is another person, a proxy, that can make decisions for you. Okay? So who can give consent? Durable power of attorneys. If the patient has dementia, they're incompetent, they're confused, they're unconscious, they're in coma, who can give consent? Durable power of attorney. Now, if there is a durable power of attorney, and there's next of kin, durable power of attorney takes over, not the next of kin. Okay? Because the person has said, this is who I want. That will overrule anything else. If there is no DPA, then of course we go down next of kin. Spouse, kids, parents, brothers, right?
Can they change, like say they have already said that they are DNR, but it's happening and they're there and they tell you that they want to change it, can they then and there?
Of course, they can change it, but the order will not, for DNR specifically, you must have a provider prescription.
Wait, so you could be NR if you're the durable power of attorney?
Yes.
Is DPA the one where you have to have it legalized by a lawyer? and attorney?
Yeah, you have to have it witnessed and signed.
So the
they can make
living
legal
will
dec-
no, right?
Huh?
The living will is the one that does.
The living will is notarized, it's yours. Somebody could just make a living will for you. The living will is still a legal notarized document usually. So it's still, it's their wishes, it's a signed document, and I don't think it's notarized, but it's witnessed, like a nurse can sign out, like you chose this in the hospital, filled it out, and, you know, it's witnessed, this is what I want. DNRs are a little bit different, because, for example, you could be like, oh no, my mom should do a DNR, but that's not the order that's already in there, I'm sorry. Okay, forget it. There's no order. Okay? So, things like that matter, you have to set ahead of time. Okay? DNR order's in, DPA comes in, no, I want you to do everything for it. The DNR order's in, speaking out of emotion at the moment. Right? That's why it needs to be done ahead, like, unless the doctor gives an order, we follow what's already in. Okay? Family said, a patient requests to be DNR, it hasn't been processed. Alright, we're still gonna do it. So those are questions they put up on there. Patient request, family request, blah, blah, blah. The order is not in, you still perform, it says continue or start chest compression. Okay? Yes? All right, so I'm glad we cleared that up. Triage, there's one about triage, I think it's towards the end in chapter 5. Disaster planning on page, so go to chapter 76, sorry, page 76.
What chapter is it?
Chapter 5. Are you looking for the tags, Mr. Armando?
Yeah.
There's a table on page 72, categories of triage during mass
Yeah,
casualty.
let's go to that.
It's just a table though. In the bottom right corner.
Yep. Bottom
Sorry, bottom
left,
left.
page 72. So during a mass casualty triage, you need to be familiar with this. What tag do you give to the person? I'll give you a few more things that to go over here again, so feel free to read these chapters through your own. This chapter, chapter 5, please read it through, from the beginning of ergonomic principles and safety all the way through. Fire safety, bomb safety, disaster safety, like all that safety, fall safety, ergonomic principles, how you stand and turn, and I'm glad that they now included it on here, because I used to tell you to look at it in fundamentals, but now it's part of it. They do test on safety and can you how do you pick things up or move patients, those are ergonomic principles for your own safety. They do see them. Now let's go over the categories of triage during mass casualty. 4 levels: emergent, urgent, non-urgent, and expectant. Emergent is a class 1 red tag. Urgent is a class 2 yellow tag. Non-urgent, class 3 green tag.
What is a mass
Expectant, class 4 black tag. Class 4 they are expected to die. They are going to die or they are dead. Okay, so how do you know someone is going to die? Now remember, this is mass casualty triage. This is when there are more injured people than there are healthcare personnel that can watch them. Examples of this is buildings falling or bus crashes or train crashes. There's literally 70, 80, 100 people flooding, and there's no way that you can possibly go, somebody shows up, there's no way to do anything at that crash site, for each person. So you classify them. Now rule of thumbs are, for these, it says who do you attend to first?
Red tag.
The person in front of you. They call it when you're triaging. Not when you're attending, when you're triaging, you're gonna start labeling. Who do you label first? You don't know that they're
The person in front of you.
The person in front of you. You're doing the most good for the most amount of people. And that's a hard pill to swallow. You can see somebody messed up, but you're trying to triage. You have to label everybody first. Okay? So you start with what's in front of you, assess, tag, and move on. Assess, tag, move on. Assess, tag, move on. You wanna tag everybody. As people are coming in, paramedics, they will run to the red tags first. Black tags are ignored as they are dead or about to die. They won't make it to the hospital, okay? Green tag should be set to the side. How do you know if someone's a green tag?
They're fine.
If you can hear my voice, stand up and walk over here to the side. If they do that, they're a green tag. Get over there.
Oh, wow.
Okay, they can walk, they can listen, they're good. Move. Okay, what's the exception to that rule? They did that. They're walking.
They have a head injury?
Head injury with an altered level of consciousness. Something more is happening. Head injuries are the exception to being a green tag. You can hear me, you understand me, and you can walk. Those are automatic green tags, right? They have minimal problems, cuts, scrapes, bruises. But if it's a head injury, they need to be further assessed. Are they fully there? What's your name? Where are you going? What happened? What day is it? If they're good, move along. But if they're confused, or altered level of consciousness, then they're a red tag. Something's happening internally. So altered level of consciousness with the head injury, red tag. Something's happening internally. They have at the very least a concussion. It needs to be looked at. Okay? Urgent or delayed, yellow tags. These are usually broken bones that are not open or compound fractures.
Not open.
Red tag, if they're open, actively bleeding, or compound fractures, altered level of consciousness, they need to go. Expectant, if their airway is blocked, or you cannot fix it with positioning, they're black, okay? If they have an open head injury, meaning something is through their head, they're black, okay? They're gonna die. Okay? 7-year-old little girl is gasping for air and you can't position her. What are you tagging her?
Black.
Tag it black and you move on.
5 more people died because he didn't move. And she still died in front of you.
See, now you killed 6 people.
You're trying to do the most good for the most people. Okay?
Like the train.
Now, I will say this to you. The answer is she's a black tag. But I will say what a firefighter told us. We're taking some of this training a long time ago. He said, that's by the book. He said, but let me be real with you. He's like, if you don't have the heart, he's like red tagger. He's like, and that's fine. He's like, in my opinion. He's like, she'll be dead by the time they get here either way. So the next person that assesses her will know she's gone. He's like, but, he's like, that's pretty hard. He's like, now, don't do this to everybody. You have fucking red tags everywhere. Now you're doing more wrong for the entire good. Like you're not helping. This is that's a hard thing, right? When it's things like that. So if you ever work in hospitals or you're like part of a response for public or mass casualties, it's hard to have a heart to do the things you need to do. So please know how to categorize people based on these responses. Yes.
You said if they have a head injury, like something sticking into their head, they're black tag. What if they have something in their head, but they're still lucid, like they're
there?
still able to talk?
What if
Yeah.
it's like something just like
it's
in
like
the
if you remove it, then yeah, they'll die. But if you leave it in,
They're there. I would red tag them.
Okay.
So it's like, if there's still a chance. You'd be like
But I'd
red,
say
okay.
a penetrating or open wound to the head with no response, they're black tags. Like they'll ask, they'll describe it as an open head wound or a penetrating head wound. They're dead.
They're dead.
Yeah, according to. Okay, remember, please know your ergonomic principles and home safety. Look at the table at 5.5 on page 73. So you see how it says anthrax, botulism, smallpox? Now, I don't include these, but I'll always tell you something. Just because I tell you I don't include it doesn't mean you shouldn't know it. It means I'm telling you, like, not for me, but I'm more than positive that they usually come up on your A, B, or proctors. These need to be known. Anthrax, for some reason, is always asked about, okay, because that's like a terrorist situation. So anthrax, botulism, smallpox, those are the top three that I see them ask you. It's like, they'll give you like a patient with manifestations and you were supposed to know that it's anthrax, or they'll tell you they have anthrax or an anthrax attack, and what do you do? What do you give them? What's the treatment? Huh?
I think we got that one for a couple
Yeah,
of
for farm,
Yeah.
I think it's already outside.
Anthrax is a thing that like they test you on. Okay? Carbon monoxide. You can see it as carbon monoxide, right? Odorless gas. The way that they try to trick you sometimes is they'll tell you that you should install carbon monoxide outside your home. That's why it's wrong. It shouldn't be outside the home. It should be
Inside.
inside the home. Okay? So there's those. We talked about informed consent. Okay, I believe I've given you everything in order to be successful for my quiz. Now, there's more to explore, and from literally chapter 1 to 5, you will need to know, and by completing A, B, and their focus review, you will read these chapters and sections enough to be able to apply to questions. So it goes to my final and last part. The quiz, we're good, covered, out of the way. A and B, we were supposed to take it today in class. Just about every other exam, there's no reason why we're not going to take it in class, for especially practices. So, now if I'm behind schedule, you will do practice A at home. Now, whether you were doing it here or at home, I'm gonna tell you the same thing regardless. I don't have you write rationales. I don't have you do that much homework, but you do need to read the book for it. So that's why I just have you do the template. Additionally for that, and anybody who has like heard me before will tell you, I do it because, again, I have seen it succeed. I've been here 6 years. I started here literally, okay, I was term 4 when ATI got purchased by the school and implemented it. That's why I started working here, because I was supposed to be the person to teach other students how to use it. I did well on it. And then that led to working with other people from other campuses, that were item writers, and so on and so on. Point of this, we implement ATI. And to this day, I just follow it with their recommendation. The method, tried and true, I have seen it work. I have 2-3 years of data gathered of who and how they did at their levels to speak on this. Okay, nobody else tracks their thing except myself. I'm weird about that. Now, at the time it was supposed to be reported to see the success of ATI. Now I will tell you this. If you do the templates and read this, you will be able to score level 2. But again, if you're not